Welcome to this edition of Clinical Clips, an accredited continuing education activity. This brief 5-minute expert video will spotlight the daily hot topics from the conference.
Hi, this is Dr. Doug Dietrich, again back from Vienna, day 2 of Easl, the European Association of the Study for the Liver Disease. A few things we want to talk about tonight. Number one, there was a very large study from Kaiser Permanente involving actually 3 million patients looking at cancer rates in patients with and without hepatitis C. And actually it was pretty impressive that of course, liver cancer was almost 70 times more common, and non-Hodgkin's lymphoma was 3 to 6 times more common in people with hepatitis C. Very clear relationship there. There was also a lot of other GI cancers that did have increased prevalence in patients with hepatitis C, like esophagus, colon, prostate, etc., and lung, but it's not clear if those are hep C related or not. But another important thing to remember about delaying treatment, that clearly cancer is an issue here for hep C. Number two, we saw some good drug studies. C-EDGE, presented by Stefan Zoism, using the two drugs together, grazoprevir and elbasvir, the protease and NS5A. 95% overall SVR, and the failures were only related to high viral load of 800,000 or more, or pre-existing NS5A mutations. So speaking of NS5A mutations, there were two really interesting papers presented on resistance mutations. The AbbVie group presented resistance mutations on all 3 drugs, although basically the bottom line is that protease inhibitor mutations resolve, they go away on their own after 48 weeks. There were only 9% left, whereas NS5A and the non-nuke NS5B mutations persist well past 48 weeks, maybe even as late as 96. Dave Wiles presented data from the ledipasvir studies early on NS5A mutations too, and they were also 16% pre-existing, which means that NS5A mutations have a lot of fitness, they'll hang around a long time. And indeed, there were still 95% of them at 48 weeks in the patients who failed. So they fail because of NS5A resistance, and then 86% at 96 weeks. I think these resistance mutations are starting to mean something to us, that they may actually predict failure in patients who were taking NS5A-based regimens. And finally, there's always a question about relapse or reinfection in these big studies. There was a 7-year follow-up study from Norway. Obviously, these patients were treated with PEG and ribavirin 7 years ago, and many of them were IV drug users. And so basically the bottom line was, if they relapsed in their IV drug use, they had about a 15% chance of reinfection. And if they didn't use IV drugs, there was a 0% reinfection rate. And then finally, a really elegant study presented by Christoph Saracen on sofosbuvir patients that were treated with sofosbuvir in all the clinical trials, basically 3,000 patients. 12 of them had a so-called late relapse, which means after 12 weeks. And of those, 10 were available for sequencing data. Actually, and it turned out that 5 of the 12 were actually late relapsers, and they actually deep sequenced the virus and got down to the molecular level. And 7 of the 12 were reinfections, which were proven by very elegant deep sequencing. So about half the patients had late relapse, and about half the patient had reinfection. And actually, if you think about this, over 3,000 patients, there were only 5 who had a late relapse, which is pretty astounding, actually, when you think about it. So the science is really elegant here, and actually we're thinking a lot about resistance mutations and relapses and sequencing of virus. So it's getting very scientific and very fascinating. Thank you for listening. That's all we have today from Vienna. Stay tuned for tomorrow for day 3 from Easl in Vienna.
We hope you found this activity useful and educational. To receive continuing education credit and to download your printable certificate, please return to the activity webpage and click on the Claim Credit button associated with today's clinical clip.